Imagine walking into an emergency room with the worst headache of your life. You're dizzy and something feels terribly wrong. Your teenage son called 911. The ER nurse examines you and sends you home with pain medication, saying it's just a migraine. 30 hours later, you're back in the ER, and this time, the damage is permanent. That's what happened to Chiaka Stewart. The jury awarded her $70.8 million. Let's break it down and understand what went wrong. Hello everybody, welcome back to The Verdict Doctor, where we analyze medical malpractice verdicts to help you stay safe. Today's case is Stewart versus Tampa General Hospital, decided in Hillsborough County, Florida, in September of 2025. Chiaka was a 38-year-old single mother of two in July 2021 when she developed an absolutely crushing headache. Her 16-year-old son called 911, and she was brought to the Brandon Healthplex, a freestanding emergency room. Chiaka had several known risk factors for blood clots: diabetes, being overweight, and she had recently started birth control. She reported the worst headache of her life, dizziness, and extreme sensitivity to light and sound. Red flags for any provider. She was treated by nurse Heather Anderson, an APRN practicing autonomously under a Florida law passed in 2020. Nurse Anderson diagnosed a typical migraine and ordered a headache cocktail of Benadryl, Reglan, Decadron, and Toradol. But here is the critical failure. They did not order a CT scan, despite the scanner being right there in the building. No neurologist was consulted. After about 4 hours of observation and pain meds, she was discharged and sent home. The ER physician on duty, Dr. Druktinas, may have never even examined her. There's no documentation he ever saw her. Over the next 30 hours, Chiaka deteriorated. She developed right-sided pain and left-sided numbness. She was having a stroke. When they finally did imaging at the main campus, they found cerebral venous sinus thrombosis, extensive clotting in the brain. While heparin saved her life, the delay caused permanent damage. Chiaka is now nearly blind and has left-sided paralysis. The standard of care is clear. When a patient has acute neurological symptoms and high risk factors, you image the brain. Period. A neuroradiologist expert testified that the clotting was so extensive, it would have been visible during that first ER visit. The jury awarded $70.8 million, including $51 million for pain and suffering, and $17 million for her future medical care. But Tampa General is trying to use a Medicaid law to cap her damages at just $300,000. This is now a constitutional fight. What can you learn? First, know the signs of stroke. Be fast. Balance, eyes, face, arm, speech, and time to call 911. Second, if they want to send you home without a scan, push back. Ask them to document in your chart that they declined your request. Chiaka Stewart's instincts were right. Don't let the system fail you. Thanks for watching, and stay safe. This analysis is for educational purposes only and does not constitute legal or medical advice. Consult with a qualified professional.